I'm Becky Wydysh. I'm the chairman of the Niagara County Legislature, and speaking with me today I have Sheriff Filicetti, Daniel Stapleton, Public Director of Health for Niagara County, and Jonathan Schultz, the Director of Emergency Management. First of all, let me start by saying that Niagara County still does not have any positive cases of COVID-19. There are no positive cases that have been confirmed in Niagara County as of yet. However, yesterday afternoon, we did see Monroe County announce positive cases and then declare a state of emergency. Neighboring Orleans County also then announced their own state of emergency. Late last evening, 3 positive cases of COVID-19 were confirmed in Erie County, followed by their declaration of state of emergency just this morning. At this time, with our surrounding counties having done so, we feel it is the appropriate preemptive action to declare a state of emergency here in Niagara County as of 2 p.m. today. Declaring state of emergency allows us the authority and the ability to implement public protective measures and continue to receive state and federal resources should we need them. We know that coronavirus is moving in our direction and that we will likely have positive cases in the near future. To that end, I've been in regular consultation with our school districts, and they have made the following decision and given me a statement to read on their behalf. Niagara County has issued a state of emergency, and the Niagara County Health Department has recommended that all schools be closed for students effective Monday, March 16th and until further notice. Therefore, all schools in Niagara County will be closed for students beginning Monday, March 16th and until further notice. Districts will reassess student attendance weekly. Districts will be providing separate information on staff attendance, academics, and food service. At this time, it is not our intention to close county buildings, as we do provide necessary services to our residents. We do, however, ask that everyone use good common sense and follow the CDC guidelines when you're deciding whether or not you should be coming into those offices, for your health and for that of our employees. Please remember that many of our services can be completed by a phone call or through mail, and we ask you to do that whenever possible. We also ask you to do that in other areas of your life. Take precautions where you can. When shopping, seeking entertainment, visiting friends and family, again, not just for your health, but for those who you might come into contact with who have underlying health concerns. Please again use common sense in deciding if you should be going out to those events or maybe staying at home. Governor Cuomo's executive order has already prohibited gatherings of 500 or more individuals and cuts in half the official seating capacities in places like restaurants, movie theaters, etc. We ask that our local establishments be understanding and that you follow these new mandates. We will continue to inform and update you as often as possible and ask your understanding, as this situation is evolving rapidly. I have every confidence that Daniel Stapleton, our Director of Public Health, and his staff, his whole team, are well equipped and working hard to keep us safe and informed.
I'm going to make this very brief. I want to give you an update on where we are in Niagara County in terms of the cases. We have no positive cases in Niagara County. We have 12 individuals that are quarantined in their home. We've done a number of testings, and so far we do not have a case in Niagara County. But now we're not waiting for a positive case to dictate what we do. We're looking at the science, we're looking at the facts, and we're making decisions based on conversations we have with our experts, and we'll continue to do that. We all know there's no vaccination for coronavirus, and the earliest possible date we're looking at is 12 to 18 months, more likely 18 months. Also, antivirals are not effective. Those hopefully will be available within 4 to 5 months. So because of those facts and the science we're looking at, there are certain things you can do out in the public to make sure that you mitigate the spread of this virus. I talk about things like non-pharmaceutical interventions, NPIs if you will. Those are the things that we do every day in public health, and you should do as well. You don't need to wait until there's an outbreak of disease to take some of these precautions. So we talk about things like washing your hands. Not exciting, but the number one way to prevent the spread of disease when you have no vaccine available. And all of you can do that every single day, whether we have an outbreak or not. Other things you can do, avoid touching your eyes, your face, your ears, everything like this. The average person does that 90 times a day. You got to be conscious of what the actions you're taking and reduce those types of things. Avoid contact with people who are sick. If you're sick, don't go to work. Don't go to church. Don't go to those places you normally go during something like this. Common sense approaches, if you will. When you practice good hygiene, when you're sneezing, sneeze in the crook of your elbow. Use a tissue and throw it away after you use it. Simple things like that. Also cleaning and disinfecting areas where you come in close contact with in your home. If you go to work, don't expect someone else to clean your keyboard. Don't expect someone else to clean your phone. Do those things that you can do on a daily basis to reduce the risk to you and those that you love. Also, if you have symptoms consistent with coronavirus, which are identical to the seasonal flu, call your personal physicians before you go to their office. Do not go there directly. Talk to them. If you do not have a primary care physician or can't get a hold of yours and you're going to a immediate care center or the local emergency department, call them first. Don't go there. Don't go there and spread the disease that you might have. Simple things like that are really, really important. We are operating as if this coronavirus is already here in Niagara County. Once again, we do not have any positive cases. But we all need to do these things to reduce the spread. We deal with this every day. Count on your local health department to make sure that you and your family are safe. We're not new to this, so count on us to make sure that everything is taken care of. We're on top of this.
As this situation progresses, there's going to be constant planning going on. It's a very fluid situation. We will update you the best we can from a law enforcement perspective of any changes of the law enforcement response within this county. I'll be in constant contact with the chiefs. We'll be working on that to make sure that there's a consistent law enforcement response within this county.
The one key element that's really come out and shown very well is the partnerships. The partnerships between the Sheriff's Office, Public Health, and many other agencies and working together, not only within our county, but crossing county lines and all across western New York. How well we're all working together and bringing this the best benefit for all our citizens. The logistics and operations coming out of our facility right now are growing every day as more and more needs are coming up with our community. And our number one priority is to work with our first responders to take care of them, to make sure they're there to take care of those of you that might be sick or in need. So we're always working with them day and night to make sure that's all taken care of, as well as our doctor's offices, our nursing facilities, and also schools as well. Our emergency operations plans, our mitigation plans are in place and in full effect at this time. And we do have our emergency operations center operating. We do have it at a level 3, which is kind of a lower level at this point. Basically, we're doing a lot of operations, working with public health, and helping them to fulfill their needs and what they need to take care of our citizens here across Niagara County.
We do have a number through the state that public health is using for people to call in with questions. That number is 888-364-3065. Also keep in mind, this can be a difficult time for people. We're going through something right now that most of us haven't had to deal with in our lives. And again, with the social media and easy access to information, people hear things. It can be upsetting. Some people aren't sure how to handle it. It can cause anxiety and other mental health concerns to worsen or become an issue that weren't before maybe. So also please keep in mind the county has a 24/7 crisis services line. That number is 285-3515, and the staff there is ready, willing, and able to assist you all day long if you have questions or concerns and need to talk.
We understand that these types of decisions put inconvenience to people and make it difficult. But if we want to stop the spread of the disease and we're taking that serious, we need to take serious precautions, and that's why we're doing this.
Yeah, and of course we do ask parents to be mindful of the fact that, we need our workforces intact as well. Many of those parents are also healthcare providers that we will need in the healthcare community helping us. So it's a delicate balance and certainly something the school took into account and we as well worry about. So.
Godshall, District Superintendent there in Niagara BOCES, has been working in conjunction with the local component districts. Each one is going to communicate with their community this afternoon and tonight in terms of details about food service, about medication return, and about completing some homework, some home activities. So that's all under development and will be rolled out. So
yeah, testing is an important component of this. We want to know where the cases are. We want to know so we can identify those areas to mitigate any close contact. Testing right now is ramping up. The ability for testing is increasing on a daily basis. The ability to do sampling, which is done separately from the testing, is something we're working on as well. Talking with our local healthcare providers about how we can make that happen quicker and easier. Once again, people need to meet certain criteria before they'll be approved for testing. People can't just say, well, I'm worried and I want to go get tested. It's not the criteria that's followed. We follow CDC criteria to make those decisions, and all providers are aware of those criteria. But we have people calling us on a daily basis. We're giving them direction when we can, but that's something we're working on around the clock every single day.
Are you going to be doing drive-through testing like they're doing in the rest of the state?
Well, there's 1 or 2 counties in all of New York State that are doing it. We're currently under discussion with something like that, but it's still preliminary. There is no testing in this county. Most counties do not have a public health lab like Erie County does. So they're looking at Erie County Public Health Lab, came on last week. We understand that Roswell Park is going to be coming up on the next week or 2. They're waiting for equipment. Wadsworth Laboratory in Albany, the state public health lab, is doing testing. Quest and other private companies are doing testing. So, like I said, and then I expect that will increase. Rochester is doing testing, not Rochester Department of Health, but I believe the hospital. So it's a lot of different people coming together, increasing the capacity for Western New York, and I think I'm very pleased with how quickly they've developed that. Getting the supplies and deciding how you're going to do that is equally
Yeah,
important.
this is a very fluid, evolving situation, and we of course will be in constant contact with each other as the situation escalates. Again, we still have no positive cases here in Niagara County. We have public services that need to be provided, and we're going to maintain those services. And if we need to have that discussion in the future, we will, but we are not there yet.
True, 80% of people who get the coronavirus, who get COVID-19 will have minor symptoms. They'll resolve on its own. We're making sure that the 20% who can have negative impacts from it are taken care of, are prioritized, and that's why difficult decisions like nursing homes are implementing right now, and assisted living centers are implementing right now, and senior apartments are implementing right now, are ways that we're going to make sure that that population stays healthy and protected. Those 14 people are asymptomatic. They do not have symptoms. That's important. We do not have people under quarantine who have symptoms. And most likely they will not develop those symptoms. But we visit them twice a day, every day, to make sure that they don't develop symptoms. Things like temperature, cough, those types of things.
With the sports leagues and that saying that they were going to reevaluate in 30 days, it seems like a lot of people were thinking that in a month, 6 weeks, that maybe this would be more under control, that maybe things would get back to normal in that. But it seems like your timetable is a little bit longer than that. Are you thinking that cancellations, postponements, things like that are going to now probably extend into the summer?
We just don't know that yet. It's too early to say that. We have to see how things evolve over the next few days and when that first positive case happens. Again, very fluid, ever-changing situation. We will continue to keep you updated.